Hi everyone, welcome to this month's blog on gender urinary imaging. My name is Manoj Matthew and I'm a body MRI fellow at Stanford University. I'd like to first of all thank all the senior editors for all the help that they gave in editing this blog. Background tumor perfusion may allow evaluation of tumor response to treatment. This group used arterial spin labeled perfusion MRI to evaluate tumor response of metastatic renal cell carcinoma after treatment with vascular endothelial growth factor tyrosine kinase inhibitors. They prospectively evaluated 28 patients and determined the correlation between ASL perfusion MRI and objective response rate and progression-free survival. The group determined response by using RECIST 1.1. The baseline study was obtained prior to treatment, as well as post-treatment scans at 2 weeks, 12 weeks, and 24 weeks. They showed that responders had a higher baseline tumor perfusion than non-responders. The reduction of the perfusion was not associated with objective response rate or progression-free survival. In conclusion, the authors suggest that ASL MRI may play a role in the early detection of disease progression in metastatic RCC and assist in the detection of responders to VEGF inhibitors. This group used placental MRI to identify the intraplacental vessel diameter and to determine if there's an association with placenta accreta spectrum disorder and peripartum complications. Two radiologists prospectively evaluated 160 women. 81% were diagnosed with PAS, 54% of which had placenta accreta. At delivery, 24% of subjects experienced massive blood loss. IFVs were identified in 86% of patients with PAS and in 98% of patients with placenta accreta. The relative risk ratio was 2.4 for PAS and 10 for accreta when IFVs were visible. IFVs greater than 2 millimeters were associated with PAS and those greater than 3 millimeters were associated with placenta accreta and peripartum complications, including massive bleeding. The authors suggest that the combination of IFVs with other MR descriptors have improved ability to predict PAS with larger diameters, predictive of placenta accreta and complications such as massive blood loss. This article is a consensus statement between the ACR and the National Kidney Foundation to evaluate the risk of NSF from various gadolinium-based agents. A multidisciplinary group of radiologists and nephrologists evaluated the current literature and determined that the NSF risk from group 2 gadolinium-based agents is low. The systematic review cited a paper that shows that none of 4,931 patients with GFR less than 30 developed NSF when using group 2 agents. No unconfounded cases of NSF have been reported with group 3 agents. This group conducted a retrospective study to evaluate the safety, technical results, and the clinical outcome of CT-guided percutaneous microwave ablation of T1A RCC. 119 T1A RCCs were treated in 106 patients with technical success in 100% of the tumors, and complete response in 95.3% and partial response in 4.7% of patients. Local progression-free survival and overall survival were 100% and 99% at 1 year, 92.8% and 97.7% at 2 years, and 90.6% and 94.6% at 3 years. Only 7 patients had complications. The group concludes that CT-guided percutaneous microwave ablation is a feasible alternative to treat T1A RCCs with its high rates of technical success, low complication rate, and excellent progression-free survival and overall survival. This group conducted a multi-center retrospective study on 364 patients with pathologically confirmed clear cell RCC. The group used a pre-operative manually optimized MR radiomics model on T2-weighted and T1-weighted post-contrast imaging to predict the tumor stage, size, grade, and necrosis score. This was compared to a tree-based pipeline optimization tool. The group had a training set of 254 patients and a testing set of 110 patients. The MR Radiomics model performed similar to the tree-based pipeline optimization tool. This group retrospectively reviewed the images of 35 patients with unilateral undescended testes. B0 and B800 DWI images were obtained and mean ADC values were compared between normal testes, undescended testes, and malignant transformation of the undescended testes. The mean ADC values were statistically different between the groups. The calculated cutoffs for differentiating normal and undescended testes had a sensitivity of 88%, specificity of 91%, and accuracy of 90%, while the cutoff value for differentiating normal and malignant transformation of undescended testes had a sensitivity of 100%, specificity of 31%, and accuracy of 43%. This retrospective study evaluated 61 patients who underwent full field of view DWI and reduced field of view DWI. Image quality assessment, ADC values, and BI-RAD scores were obtained and compared for these images. The contrast to noise ratio was higher for the reduced field of view DWI, while SNR was lower for full field of view DWI. ADC values obtained from muscle-invasive bladder cancers were significantly lower than non-muscle invasive bladder cancers. The subjective scores obtained from reduced field of view DWI were higher than full field of view DWI, with biplanar reduced field of view DWI having the highest predictive power for the determination of muscle-invasive bladder cancer. Thanks again for listening to the GU Research blog, and hope to see you next time.